may I invite the first group to join the stage with such an engaging topic about a preliminary study, the association of gut microbiota pattern and blood pressure among population in a rural area in Thailand, presented by Mr. Thanapoj Buakhao.
Good morning, dear judges and guests. My name is Thanapoj Buakhao, fifth-year medical student from Phramongkutklao College of Medicine, and I am today to present a research topic of a preliminary study, the association of gut microbiota pattern and blood pressure among population in a rural area in Thailand. So let's begin with our study background. Gut microbiota are beneficial microorganisms that live in our digestive tract and provide some short-chain fatty acids and crucial vitamins to the body. We have seen many products that are made to utilize this benefit, so we look further and dig deeper into what more can the gut microbiota really do. As said in many studies, there are such things such as gut-brain kinesiasis, which is a theory supporting the relationship between hypertension and the gut microbiota. And it was said that the unbalanced species of gut microbiota could lead to the high blood pressure or even hypertension, and which become our concern because hypertension is one of the world's major causes of premature death worldwide and has overtaken more than 25% of Thai population, and also be the main complaint of our community. Most of them are also unaware of the serious complications that the disease may bring, that such as a stroke, coronary heart disease, retinopathy, nephropathy, and many more. So our objective is to study the pattern of gut microbiota in participants of hypertensive and non-hypertensive groups in Thailand, which haven't done before, and to create a knowledge that may lead us to more effective ways to treat hypertension in the near future. This study was designed as a descriptive cross-sectional study conducted in Thakadan Sam Chai Khet, Chachoengsao province, that were considered to be a representative of Thai rural population. Our sample size includes 35 subjects from 2 villages, and they were recruited by purposive sampling method in March 2022. From the whole group, 18 subjects were placed in hypertension group, and another 17 were placed in non-hypertension group based on their past diagnosis. Inclusion criteria are shown as follows: at 20 to 70 years old and living in our setting for at least a year. And for inclusion criteria, we focus on the confounding factors that would affect the gut microbiota pattern and blood pressure as shown in the slide. Let's move on to the data collection and measurement. The stool was sent for the PCR. Blood pressure was measured by using the mercury sphygmomanometer, and the lipid profile was collected. Our statistics were performed using the STATA program-based technique as shown as follows. For the result, the mean systolic blood pressure and diastolic blood pressure in hypertension group and were 150 and 105 millimeter of mercury. Conversely, the mean systolic blood pressure of non-hypertensive group is 120, and the diastolic blood pressure is around 80 millimeter of mercury. Moreover, lipid profile from blood sampling showed no difference in triglyceride, cholesterol, HDL, LDL between hypertension and non-hypertension group. The difference of number of each gut microbiome collected from the stool is not statistically significant between two groups. By the way, we have noted the difference of gamma proteobacteria species between two groups that the data was had no significance statistically at p-level of 0.057. After the correlation between systolic and diastolic blood pressure in each group were analyzed, we found that the Phramongkutklao shows significant negative correlation in the diastolic blood pressure of non-hypertensive group, while Caminshare species shows significant positive correlation of diastolic blood pressure of hypertensive grade 2. So we found positive correlation between Phramongkutklao species and diastolic blood pressure in hypertensive participants using antihypertensive medication. So as mentioned earlier, the results show that there are significant negative correlation between Phramongkutklao species and the diastolic blood pressure in non-hypertension group, which is not similar to other previous studies, but we can imply that we did not evaluate and identify for specific genus and species. Meanwhile, we found positive correlation between Phramongkutklao species and the diastolic blood pressure in hypertensive participants using antihypertensive medication, which correlates to other research, which said that the higher abundance of Phramongkutklao in hypertension group are found compared to the healthy group. And lastly, we found significant positive correlation between Akkermansia species and the absolute blood pressure in the hypertension grade 2. Even though numerous study has highlighted the positive role of the Akkermansia species in lowering blood pressure, but however, few studies, including our study, has shown the trend of the increased abundance of Akkermansia with the increase of the blood pressure. So for this discussion about the current facts, evidence, controversy about the role of Akkermansia and Phramongkutklao species in the pathophysiology of hypertension and its effect on blood pressure is needed. So our research strength is that we are the very first research to study about the association in Thai population. We also use the precise inclusion criteria to make our results more accurate. And our study is also community-based that provides participants to know their health status and get advice on how they improve their health. If it shows any abnormalities, the community doctor will be notified to pay attention to that part. However, our study has small sample size that may not truly represent the whole population. A limitation of the primer that we use or laboratory technologies, sequencing like next generation sequencing due to the high cost laboratory procedure are the limited. So we recommend the further research to using the larger sample size and also adding the more primer for Capsula, Clostridium, and Streptococcus species. For the conclusion, the data obtained from this study has shown the trend of gut microbiome associated with the hypertension in Thai urban population, which purports to be the baseline for the further study and intervention which could lead to additional treatment for hypertensive patients in the future. Thank you.
Such an interesting topic.
Any comments from our judges?
Congratulations. I would like to know, did you take into account the duration of the duration of hypertension among hypertensive patients?
We have collected the data, but we did not using it, analyzing. But there is no participant that had a hypertensive complication before, such as a stroke or myocardial infarction, heart failure, and anything. So they are the hypertensive patient with no complication. Maybe they are well controlled, or they just newly diagnosed, and we have collect more information about the drugs and medication that they use, how many drugs they use, and something like that. But we did not analyze it for today's presentation, but they not found some significant results.
Thanks.
Any more questions? Can I have a question, please?
Okay, please go ahead.
Yes. You said this is preliminary research. What the future research? Would you extend your study from this one?
For the further research, I think that they probably have the intervention, or maybe have adding more primer, such as a capsula, and as we have mentioned. Like we can use the intervention such as probiotics or any diet modification for patients to modify their gut microbiome. Actually, we have already think of that, but there's some limitation for our research.
Yeah, I think before you further your study, maybe you have to try to explain how you discuss of your research.
So we sorry.
Go on, please explain your result.
So our research going to show the trend of the gut microbiome in the hypertension and non-hypertension group. So we found that there's controversy about it because we did not evaluate the identical species or genus. So there's controversy about the Phramongkutklao species, and also a comment share that controversy from the other previous studies also. But we can explain that Thai population is not same as the another countries because the lifestyle, the diet is not the same as theirs.
Thank you so much.
Thank you.